Yes, those hems are getting shorter and shorter and shorter. On today's Ask the Derm, Dr. Groff is here with how to treat. Do you have those spider veins on your legs and you want to get rid of them? Dr. Groff, good morning. Thank you for being here.
Good morning.
I think I have one or two.
Most people do.
Most people do.
Yeah.
What causes them?
Well, the biggest thing is probably heredity, but pregnancy certainly brings them about because there's a lot of pressure in the abdomen. It forces all the blood to your extremities. Occupational, if you're on your feet a lot like you are, that can tend to make leg veins appear. So those are probably the three biggest things.
And then there are like small ones and then there are really big ones. Are they dangerous?
Not usually. In rare cases, they can be. If you're having symptoms like pain or your legs feel heavy or tired all the time, then it can be a danger factor, but most of them are harmless and more of a cosmetic nuisance.
And do we see them more as we get older?
Oh, certainly, yeah, they definitely get worse with age. But I mean, we see young girls, even like Brittany here, she's in her 20s and she already has some back here, which you can see.
Let's take a look. So we're gonna, by the way, if you're having like breakfast and you're leaving, don't go anywhere because we're gonna watch these disappear in just a few seconds. But can you tell us a little bit about the treatment? What is the treatment for them? And then you also have some pictures to give us an idea of how fast you can get rid of them.
Sure, yeah. These are called reticular veins, so they're actually a little bit bigger than the typical spider veins you see, the ones that look like red and purple little lines. So these are reticular, a little bit bigger, but easily treatable. The best treatment for these is to inject a medication called Sotradecol in there.
Okay.
But we use a tiny, tiny needle. It's about the same size as a Botox needle.
Okay. And then can we see the results? You brought some pictures,
yeah, let's
so
take a look at,
you know, you could see what it looks like. Oh, wow, what a difference.
Yes, that's just one treatment, and you can see that's more of almost like a varicose vein because it's bulging.
Okay.
But you can see we can get some great results with this one treatment. I usually tell patients to expect at least 50% improvement with one treatment, but it can certainly be higher than that, like these cases show.
This is a big, huge difference.
Yeah,
big,
so
huge
that's
difference.
5 months after one treatment, and this is 6 months after one treatment.
Wow, they're like all gone almost.
Yeah, so
I love it.
Excellent response.
Okay, so you're going to show us how to do it.
Yeah, we'll do this.
If you are, you know, not into the needle thing like myself, maybe just turn this way or
It'll
something.
take me, I got to get my gloves on, and
don't squirm. I'm sure you're used to it. Oh,
so Isabel's making up the solution right now. She's making up what's called Sotradecol solution, and she's turning it into a foam.
Okay.
This is the best treatment. It's called foam sclerotherapy.
Okay.
And this is what we do for these reticular veins.
Oh, I'm gonna.
So you can see how small this.
Somebody tell me when it's over.
The needle's tiny.
Yeah, but still.
So you can see the medication going up through the vein there. Now I can just kind of push it a little bit.
I don't do needles.
This isn't too bad. There it goes. Traveling up,
Can you feel the needle?
I mean, it's a little pinch, but it's tolerable.
You're just like sitting there, not even flinching.
It's very tolerable.
Really?
Yeah.
Even if, are you a baby or are you
I'm
not?
the biggest baby
Oh,
ever.
you are?
Yeah.
Okay, well that makes me feel better. Okay, so you just finished. And then Dr. Groff, is this an expensive procedure? Like how much would something like this cost?
Anywhere, depending on the number of, you can see the foam there.
Yeah.
Depending on the number of treatments and the size and the number of vessels, it can range from just a couple $100 up to maybe $1,000 a leg if they have extensive veins.
And you would have to keep doing it over and over again, or?
No, once they're treated, they're permanently gone. Now you'll get new ones over time, of course, so then you'll have to come back in for more treatment.
That was cool.
Pretty neat, huh?
Dr. Groff, thank you for being here.
You're welcome.
If you want to get more information and learn more about how you could do this to yourself, fox5sandiego.com, click the See On tab. It'll get you hooked up with the doctor.